When you talk about something like blood sugar, I'll actually paraphrase from the book itself. You wrote, Greek physician Aretaeus wrote, diabetes is a dreadful affliction, not very frequent among men. So you hear that and you say, okay, well, today it's pretty damn, widespread. What changed since the time of Aretaeus in 2nd century AD to today, where we have an epidemic impacting so many?
Probably the biggest change, like in relation to blood sugar levels increasing and the increased prevalence of diabetes, would really be refined sugar. I mean, no shocker there, right? Both from the sense of now 75% of all packaged foods contain added sugars, but also from the fact that we went from consuming just maybe 10 gallons of like soft drinks per year in like 1950, and by 1975 it was like 55 gallons. So there was like a 5-fold increase in soft drink intake, basically from the 50s to like the 70s. So when you have all this refined sugar, I mean, it's crazy when you think about it. If you break it down into the fact that like we used to only get like the amount of sugar in a can of Coke in like 1900 all year, and now we're consuming like 2 or 3 of those per day in regards to the amount of sugar. That's really the driving force. And it's really the children. I think I've mentioned this to you before, the fact that like anywhere from 25 to even up to upwards of 50% of children's total caloric intake is coming from added sugars. And by the time, you're 16, 20 years old, you're metabolically broken so that you can't even really handle much more than 40 grams of sugar per day.
Yeah, we've spoke about this before, how addictive sugar is. You're talking about like on level of cocaine, other things, and that's the sad part. But, it's been established that sugar is a causing agent in insulin resistance. But is there a scale to it as far as what types of sugars? Yes, we've seen, all the kind of crappier corn syrup and everything come in. But are there things we shouldn't be demonizing as much in sugars? We need some sugars, correct? So can you give us like a scale of the worst to best sugars?
Yeah. So, I mean, of course, it always comes down to quantity. So you do have your healthier, more natural sugars like honey, 100% maple syrup. And then on the other side, you have high fructose corn syrup, refined, table sugar, which is obviously lacking any type of other anti-inflammatory molecules because it's just coming in a bottle or coming in a spoon and not packaged in a whole food that's going to provide other constituents, right? Mm-hmm. So you definitely are better off, getting, natural sugars from fruits and from honey and maple syrup. Now, that being said, you still want to pair those with protein, fat to curb any type of excessive sugar spike, because if you have a lot of those, you can end up going hypoglycemic and it leads to a vicious cycle. So there's always a happy medium, but I definitely think there's been an over demonization of all sugar for sure.
Yeah, it seems that way that we can't quite decipher, what is what here, and we just lump sugar together. Now, another part of the equation is the, usage of artificial sugars. So you have things like saccharin, sucralose, which is Splenda, aspartame, which is equal. And many people do replace regular sugar, let's say, with those just for the calorie content of 0 and thinking they can lose weight. But is it really safe? What does the research say? I know you wrote about it in the book, but is it safe?
So, according to the FDA, they have set levels that are considered safe. And there's been actual human clinical studies giving amounts of saccharin and amounts of sucralose, which is in things like Splenda, below or at that threshold that's considered safe, that has been shown to not only lead to gut dysbiosis, but an increase in insulin resistance relatively quickly, like within just a week of consuming that. They've tested other ones, such as stevia, that has not shown that effect. So there are certain, basically, let's call them non-caloric sweeteners that have been shown to induce insulin resistance fairly quickly. And those two would be, again, saccharin and sucralose. And the ones that have not been shown to induce that would be like stevia, monk fruit, and even aspartame. I mean, aspartame obviously has a lot of animal studies that are showing, cancer and this and that. Those doses would be very, very hard to reach from a human intake. But in the human clinicals, aspartame didn't induce that insulin resistance. It was really those two, saccharin and sucralose.
What about something like xylitol, which you find sometimes in, toothpaste or gum because of the bacteria kind of inhibiting factor?
Right. Those also don't really seem to induce insulin resistance, although they do pull water with it in the gastrointestinal system, and there is more gastrointestinal disturbances, more watery stools, things like that.